guys. So this is my makeup look for today. What do you think? Because I just found out that if I wear makeup, that means I'm not blind. Check it out.
So I just have to make one more post about this one chronic pain patient who just bugged the fucking shit out of me. She's called the blind makeup lady or something. She's black, so I don't remember what So she says she's blind, but she shows how she's putting on makeup. Everything is all about, all of her disorders, her disabilities, her pain medications. But she's blind and puts on makeup. So then she vapes her eyes, where sometimes she's acting like a blind person, but then she's not. And in the background, always in the background, she's got an iron. All by herself.
All by myself.
This blind person is ironing. Okay. So there's all these disability fakers. Obviously, no, there's not.
You know, Amy, I saw your comments coming in the other night, and I wasn't going to bother with it. But you left comment after comment, and then you started making videos after you blocked me like a coward. Let's talk about the fact that I went to a high school for blind people, where they teach you independent living skills, like learning how to iron. I even had a teacher that would count the popcorn kernels that she would have in a jar and dump them on the floor, and you had to sweep them up, and she would count it back. But it's very scary as a nurse that you don't understand that blindness is on a spectrum. As far as the ironing board is concerned, I couldn't iron myself, and I definitely couldn't possibly live with somebody else. But what else did you have to say?
I from everybody before her surgery what she was going to be getting for pain. What she needed to know what anesthesia was going to give her, what recovery was going to give her, and so she wanted all these medications so that she wouldn't have muscle spasms during surgery. Well, this just shows how stupid she is, because when you're under anesthesia, you are anesthetized and you're paralyzed, so you don't have muscle spasms when you're completely under anesthesia. I mean, she went on and on how she needed to have a one-on-one nurse so she could get her pain medication every 2 hours, but the night shift nurses didn't give her the, adequate amount. I'm retired now, but just recently, and so I'm going to let you guys know that I myself have disabilities. I had spinal fusion in 2014. It was not successful, and I also have seizure disorder. The seizure disorder is why I had to retire from nursing.
First of all, yes, my pain management has to be coordinated between palliative care and my surgeon. Those are the rules. As far as anesthesia is concerned, yes, there has to be a conversation, because with the damage to the nervous system, not just the nerves, it does at times require additional anesthesia. And the reason I have to have that conversation is because, one, I've woken up during surgery, and in a previous OBGYN surgery, when I was in the stirrups, my legs did go into spasm because there was not an appropriate amount of, anesthesia. If you ask any surgeon, any dental surgeon, any anesthesiologist, these are things that have to be covered for a CRPS patient. Never once in that video or in the hospital did I state that I needed a one-on-one nurse to come in every 2 hours for pain medication. I said the hospitalist came in and was very educated on CRPS and said there would be a nurse coming in every 2 hours to give me medication. Now, once they took me off the catheter, I got to the point where I was holding it because I didn't want them coming in every 30 minutes to either take me to the bathroom or give me medication. So I would try to hold it for when it was time for me to have medication. And yes, the night shift did slip up a couple of times, but I also said I had some very good nurses. And if I am such a horrible patient, why, yesterday, when I went to the hospital for my follow-up, did I go up there with thank you notes addressed to each nurse individually, because I got their names with thank you notes and gifts for both the day shift and the night shift. But let's see what else you had to say.
It doesn't matter if you've had a fentanyl patch for a long time, it's still in your system, in a toxicology report. And when you are driving and have been in an accident, despite whose fault it was, you can still have a DUI.
You would know.
And I'm happy. I don't take any medications for my back. I take medications for my seizure disorder. And it was completely against the American Disability Act that I'm no longer able to be a nurse because of my...
So you had a lot to say about how we demand benzodiazepines and opiates, and we just won't stop until we get them. And you hyper-focused on supposedly some patients driving under the influence, which was a really odd focus, in my opinion. And you kept reiterating how you retired recently. So my friends and I looked around a little bit, and we found a few things that were a matter of public record. This document took effect as of October 12th of last year, retiring recently against Amy H. Billy, as in Amy Hastings Billy. This is page 1 of the judgment against Amy Billy, aka Amy Hastings Billy. This is page 2. Please pause to read all of this. This details each reason a nurse's license might come into question. This is page 3, where Amy Hastings was pulled over and officers noticed poor speech and poor coordination. She had benzodiazepines, carisoprodol, which is apparently soma, a very powerful muscle relaxer, and zolpidem in her system. Pause to read. Amy Hastings Billy has received disciplinary action and cannot practice nursing for 36 months due to dangerous use of drugs and alcohol. So maybe, Amy, instead of worrying about what we're doing, and now that you have all of this free time, maybe you should worry about yourself and not project so much on us.